All right, so this is our debrief from our community outreach project with Yakima Union Gospel Mission. We met with, what was her name?
Gabby.
Dr. Gabby. And we were able to have a 30-minute conversation with her a couple weeks ago. We'll talk about the theme here of the process of the outreach itself. So I'll just say a few things and we'll all chime in here. But so getting in contact with them was initially through email, and then some of us had already had prior time working there as students, so kind of made it easier to communicate with them in that sense. You guys have anything for that?
I think that was the main thing, just contacting them through email and then being able to just schedule a time to go in with her. And then once we actually got that scheduled meeting, she was very friendly and welcoming towards us and any questions we had, and then just being interested in what we were talking about as a whole and the different ideas we were bringing.
Yeah, I mean, also to clarify, we were talking and communicating with Christy, but she was unavailable for the meeting, so she sent in Gabby as sort of her inner place, I guess, to relay the information that we had with her. And then how we were received, I think everything was pretty laid back, relaxed. I think at least for me, the doors were locked, obviously, because it was around lunchtime. But the front desk let me in. They said that they just sent me back. I went back, and I think Gabby was with a patient or something, so we ended up being like 10, 15 minutes, meeting like 10, 15 minutes later than what you anticipated because she was with a patient. But she seemed friendly. She was pretty welcoming, as well as the guy working in her office, Tall, I think.
Yeah, he's a student here.
Med student. He was pretty friendly. We were chatting while we waited with Gabby. And then the third point.
They did go as expected.
Yeah, I mean, I think we expected to just go in there. At least I don't think I knew what to expect because I don't know how formal the meeting was going to be or what exactly they knew and what they didn't know. It seems like for the most part, every uh, doctor or medical facility doesn't really know what physical therapy does in general. So I was expecting that, but just in general, I was like, we'll see how this conversation goes. But I think overall it went well, and in some senses it did go how we expected. In the sense that she didn't really know what all we were about as far as our profession and even here at PNWU. So it was really good to be able to talk to her and kind of explain some of our, I don't know, just explain our scope of practice and what exactly we could offer or how we can try to work together. And that kind of brings us to our next point or theme here, specific things that we learned about networking professionally and within our community. Do you guys have any points on that one?
I think it's just being able to network with different professionals because we're all going to be working together around different patient cases. So being able to collaborate and network and have an understanding of what we all do so it can make the patient experience better is like a really good tool to have.
Yeah, just one other quick thing that I did learn about that meeting is just how they acknowledge that there is a need for PT despite not maybe knowing the full scope of the practice. They expressed multiple times how they do in fact need PT, and they just need to wait for us, I guess, to be more available if possible there for patients. Yeah.
Yeah, I think that's a good point because that was kind of what our entire conversation revolved around. It was like, yeah, there's a need, and we just hopefully want to try to find a way to have both sides work together to fill those needs. Um, we talked about how potentially, since we are a newer program, we're going to get a little better and hopefully um, be able to give more of our time to be able to help them specifically. Um, Seeing that we're growing and we'll get more faculty and more students, then maybe that'll be part of the plan as well. But I think it was nice to have like Jared and Luis did their first rotation last year or integrated clinical experience there. So I think they were pretty familiar. So it felt easier to at least be in there and let them know that we weren't foreign to YUGM at all, and kind of knew how things were working there and how those needs look like in real time. Let's see, next theme here. Yeah, so skills that our group need and to further practice or develop more effective, more comfortable with community outreach.
Do we do this one?
I think we covered it.
Yeah, that's
Okay.
yeah. So what do you guys think about skills that we need to further our practice?
I think just more practice with like more practice or like experience actually communicating with different like groups of people. I think the questions will become more familiar and just being able to come up with different ideas that will be useful to us and the other program as well as different individuals from the communities.
Yeah, another thing I think we could develop further is just how we were saying how they're not so familiar with our full scope of practice. We should probably inform ourselves or educate ourselves, each other, on what their specific scopes of practice, because there are many specialties in that facility in and of itself, and I couldn't tell you which each of them are responsible for doing. So it's kind of like a back and forth. We need to inform us, or they need to inform us better, and we need to inform them better, you could say.
Yeah, I agree. I think the nice thing about talking to her is that although they seemed like, oh, we didn't know you guys did that, they're still really open and interested on learning more about how that could fit there at YUGM. And it was really pretty much a back and forth on us giving our thoughts and her giving her thoughts on potential avenues we could pursue, and maybe even a little bit of touching on the structure of how we could potentially get like students in the summer or after hours or whatever it may be. But it was nice to get that conversation started with her and being pretty open about it.
Yeah, that kind of goes into the third theme of like the future needs of the community relationships. Some recommendations we have to ensure the next cohort is successful. Well, one of the things, this might be a slightly different topic, but one of the things we talked about is having increasing the awareness by just producing, the most basic thing we could do is producing more flyers, having them around their office, which is something we're working on doing, just printing out more flyers to get just the word out, I guess, of what PT is and what they can do. As far as recommendation for the next cohort, do you guys have anything for that?
I think one thing that we talked about was that she was really open to us as PT students being able to observe the other like specialties there, just so we're aware of what they're doing, and then when they come and see us, like what the difference is, just so we're all aware of the different things that we're doing. So being able to just have a understanding of what's going on in the clinic as a whole and just working together, just because we discussed how typically we were in the back room, so we weren't really interacting with them, and we didn't really know the other providers besides the translators that would come in, and like we'd say hi to the front desk when we walked in, but that was pretty much it. So we're kind of separated in a sense, but she was really open to having us go to other specialties and observe, or just even having us go back to the back room when we're there, say hi to her, check in, and see how she's doing and how we're doing.
Yeah, I think another thing we could potentially try to pass down to the next cohort is whenever they decide to meet with them, is maybe bringing more flyers already prepared. That way you can just kind of drop them off, and give them visuals of what exactly it is we have to offer, whether it's Walk with the Dog or any other future program that could interest the community there. And then they're really open of saying that, yeah, they could share and post it at their clinic as long as we keep it simple and make it look accessible to the community. And that kind of brings us to the next question here on theme 3 about barriers and facilitators to participating with Block with the Future Doc. Um, I think to start off with, they weren't really aware of it that well. I think they had an idea or knew that we were doing something. They didn't know really if it was like our CAMS lab or what exactly we had to offer, so we had to clarify what it was. But some things we did talk about regarding Walk with the Future Doc were transportation and how realistic it is for people to come out here to PNW to go for a walk. I mean, it seems like that could be just a pretty like straightforward barrier. I mean, not everybody can come out here to Terrace Heights, um, you know, on a Saturday morning to walk. So that was one thing we talked about.
Yeah, some of the other barriers I can think of would be just the simple. I think we've talked about it in here. Just the lack of awareness of like what it is, because again, even most people in the community, like Gabby, for example, who we met with is MD DO. I don't remember. She was not fully aware of like what PT did exactly, and I think most of the patients, probably large demographic of the patients that go to YUGM are probably not aware of what PT is either. And so in my head, I would, if I saw like a flyer, if I even saw a flyer, I wouldn't know what they were even talking about, or like what the point is of the Walk with the Future Doc.
Yeah, I think that's the main thing, just bringing up awareness, like they said, just because she didn't even know what it was, but she thought it would be nice for us to be able to bring the flyers so she could have it right above her desk so she can educate all of her patients on it, because she was open to it and thought it was a great idea just to begin a relationship between the patients there and us as a class, so we can have more like more of a relationship together as a whole.
Yeah, and I think kind of tackling more on that second question of how we can make that maybe a little bit better and more accessible. We talked about how maybe making it something that's a little bit more applicable to our community. Just seems like, especially me living here and talking to Gabby, who works with that community directly, it's not something like coming to Terrace Heights to walk for an hour. It just doesn't seem like that is really gonna do a whole lot for the community. Um, Not just because of all the barriers, but also because people probably want something that's gonna be a little bit more useful and directly impacting them in that moment, because most of them might only make it to one. So like how can we make that a lasting impact, whether it's, hey, we taught them something, um, mobilization techniques. I mean, we're in PT school, so I think that's a perfect opportunity to have us as students practice some of our skills, and work directly with community members while actually trying to make a difference in like how they feel that day, or maybe even just like, hey, this is what we do as PT. It can be as easy as leading like a stretching routine or even getting our hands on patients. I know that probably requires faculty being there as well, but I think if we're PNW is about helping the community, then that should be a no-brainer for everybody, not just students. And I think that'd be really helpful. I mean, I know people here, I know the people in my community need it, and I just personally don't see it and haven't seen it with our Walk with the Future Doc so far. Um, so I think that's a area that we can develop into something a little bit more meaningful for the community.
Yeah, and then going back, so just the main things that we talked about with her to bring more awareness and connection was the flyers, and then also just observing the different specialties there. But also, she was very grateful that the time that Dr. Arabian goes there, and she's only there a few hours a day, so there's not much PT going on while we're not there for the integrated clinicals. So just bringing more opportunities for students if we have a professor who's able to go down there and be the doctor like observing the students. So I think those were the main things we talked about, just more opportunity for therapy just due to the limited time that we're there.